So 17-hydroxy progesterone, ladies, let's say you're having menstrual headaches. Most menstrual headaches are caused by too much estrogen and not enough progesterone. Too much estrogen, not enough progesterone, and we can measure that. Does that all make sense to you? Okay, the next one is insulin test. And we can also, if your cortisol level is up, your insulin level more than likely will be down. Then the most significant one, we can check your immune system. They do a salivary IgA test, okay? And we're seeing what kind of immune system challenge you're going to have going on. But I want you to look at the next one, which is the gliadin antibodies. Do you see what it says below gliadin antibodies? For grain intolerance. Do you know what's starting to happen in America today? This is what always flips people out when I talk to them about wheat products. Wheat can cause inflammation in your body. You could have inflammation in your body because you have an addiction to pastries, cookies, torpedoes of death, which you know I fondly call donuts. Torpedoes of death go right inside of you. But if you consume a lot of wheat products, it can cause an adrenal issue in your body, causing inflammation and stress. And we can prove that. Isn't that awesome? People have chronic allergies because of wheat. So you can do your own simple test. You can just do the Dr. Bob squeeze your wrist test. If you squeeze your wrist and you feel a lot of fluid underneath your hands, it's because you have a lot of water retention. So that's why I encourage flax oil. But if bright light bothers your eyes, if you get dizzy from a sit to a stand position, if you crave sugar, craving sugar is a sign to me that you probably are releasing too much cortisol, you're under stress, and you don't have enough insulin working properly in your body. So between the female hormone testing and the adrenal stress index, we can find out so much what's going on inside of you. Look at the clinical applications of the adrenal stress index, okay? And I put this in here specifically because so many people here in the room and people watching us around the world right now have. And one of them is chronic pain and fibromyalgia, inflammation of the tissues in your body. And then look at here, it says an adequate adrenal response can maintain a higher pain threshold. The adrenal stress index is used to evaluate the stress impact on chronic pain and inflammation. A proper diagnosis of low cortisol or DHEA with the circadian rhythm disruption is imperative. So if I can have a person and I can show them that they have altered cortisol levels in DHEA and they have fibromyalgia, find out what they're doing day to day that's interrupting it, whether it be sugar, whether it be stress, whether it be doing, working 2 or 3 jobs, taking care of all kinds of, just stress. Unless you eliminate that stress from your life, guess what? Your fibromyalgia is not going to go away. I had a new patient that came in the other day, and she had fibromyalgia, and she was on disability. So when I walked into the room in my mysterious, I go like, I smell cigarette smoke. You don't say anything to anybody. Then halfway through the exam, I say, so does anybody in this room smoke? And the husband was with the wife, and you know what he said? She does. Well, her fibromyalgia is not going to go away if she's smoking. Do you want to know why? Because smoking takes vitamin C out of the body. A great source of vitamin C are red peppers, yellow peppers, and orange peppers. I'd much rather have you use peppers than oranges. Because if you live in the north and the temperature is 60 degrees or less, and you're consuming oranges, it could turn to mucus inside of your intestines. So if you ever see a mucus stool and you're eating a lot of oranges and it's below 60 degrees, I learned that from my colon therapist. I get a chronic at least twice a year, spring and fall. I'd encourage you to do that also. Chronic fatigue syndrome. It's very common. There's a great book called Adrenal Fatigue. Adrenal Fatigue by Dr. James Wilson. I'd encourage you to get that book. Chronic fatigue syndrome, you see what it says a common HPA axis. You're probably wondering, what is the HPA axis? It's the hypothalamus and the pituitary gland. The hypothalamus is a part of your brain. The longer I'm in practice, the more I realize how many people have strained brains. And I'm not saying it to be silly. They have strained brains. And they have strained brains because they're not getting enough minerals inside of the body. Do you know that your blood sugar is strongly affected by the amount of stress that you're under? So if you're craving a lot of sugar, chances are you're underneath a lot of stress. You're going to get fat. And I'm not saying it to be mean. I've had people lose 30, 40, 50, 60 pounds just by eliminating sugar. You can have chronic allergies. Look at that fourth nugget there. You can have chronic allergies because of not enough cortisone in your body. So people could have allergies because of stress. You know, this always kind of amazes me during the springtime when there's pollen in the trees and they have the pollen count on the Weather Channel and they say how high it is throughout the United States. I think that's a bunch of malarkey. If pollen was the reason that people had allergy problems, guess what? Everybody would have allergies. There's certain immune systems that are weak in people, so if you're underneath a lot of stress, you have a greater chance to have chronic allergies. Do you know that if somebody has, you could have ADD and depression. This is really significant because of the brain not secreting properly and that there's not enough cortisol. You could have ADD, and that's just a part of the ongoing stress issue that goes on inside of a person's body. But let's continue on, because you can read the rest of that. If you're watching me on the internet, you can download it and you can read that. Postmenopausal pattern. There's something called andropause, which we'll talk about in a moment with men. But I want you to talk about menopause now. Menopause is not a disease condition. It's a transition that a woman goes through from having a menstrual cycle and be able to have children or to carry children or to go full term, and they stop having babies. Menopause is stopping babies. Men can actually father a child until they die. I mean, if a man is healthy, he's able to fertilize someone. Now, I'm not suggesting that if you're watching me and you're 90 years old that I'm giving you this license to have go find a new wife and have intercourse, but you know, Abraham was over 90 years old. But I'm just trying to tell you that the truth is, which really is frightening, is in America today, I've read statistics that anywhere from 20 to 40% of the men of 40 years old or older are not able to even obtain or maintain an erection. So we have a major hormonal problem that's occurring in our society. We have postmenopausal women. Now, not to be silly for you all, but let's go back to this first chart. This first chart was so important. And I want you to turn your attention to right over here, where right below DHEA, we have the androgens. We have estrone, estradiol, estriol, and progesterone. Does everybody see that? Or testosterone. I want you to see that because that is your backup reserve tank. That is the most significant part of your female hormonal health. What is that? It's your adrenal glands. So that means every woman, when they go through menopause, should go through it naturally if their adrenal glands are functioning optimally. How do you know if your adrenal glands are not functioning optimally as far as body signals? Bright light bother your eyes. You get dizzy from a sit to a stand position. You crave salt. Your back goes out easy. You don't have any energy. You crave sugar. Craving sugar, craving salt. Bright light bothers your eyes. You may wear sunglasses. People wear sunglasses usually have adrenal gland weakness. So ladies, if you have menopause issues, your goal is not to take hormone replacement therapy. Your goal is to feed your body right so your adrenal glands inside of your body, which are the pharmacists inside of your body, can make the hormones for you to function optimally. That's why I told everybody to eat red peppers, yellow peppers, and orange peppers. If you eat those every day, it's a great source of vitamin C. So there's gradual changes. You have less follicle-stimulating hormone and luteinizing hormone that's coming from your brain. Okay, and we can test that as your body goes along. So that is very, very significant for all of you. So let's talk about the male hormone panel. Now, most of the time that people don't think that men even have hormones. Right, ladies? So, the male hormone panel, I guess you got to watch out and say they could have a lot of high testosterone, but it depends on the age. But when we look at this male hormone panel, look at that box. Isn't that pretty amazing? It all starts with cholesterol, and then it goes to pregnenolone, and then it goes to progesterone, aldosterone, and then it becomes the andestrones and testosterone. You can see all that going on there? It all starts with cholesterol. Now, if it all starts with cholesterol, taking a cholesterol-lowering medication, guess what? It can affect your male hormones. Taking a cholesterol-lowering medication can also affect female hormones. Very serious. So you're taking Lipitor, Mevacor, Zocor, any kind of the cholesterol-lowering drugs. Okay, now Doug, before you start it again,